Hello, my name is Itisha Jefferson, and I'm a medical student at Loyola University Stritz School of Medicine and a 2022 to 2023 Doctors for America Jean A. Copello Health Advocacy Fellow. And this presentation will highlight my health advocacy and community and civic engagement projects over the course of this year. I am from Brooklyn, New York, and is a daughter to Jamaican parents who immigrated to America for a better opportunity. I grew up in an urban and under-resourced area that is riddled with health disparities and chronic conditions, and knew I wanted to facilitate change by serving my community as a physician. Therefore, my values are centered on achieving social justice for all, to be of service to others while living your life as a positive agent of change, and to uphold health as a human right by ensuring equal and equitable accessibility to affordable and adequate health care. One of my favorite parts of being a Copello Fellow is participating in monthly meetings that are centered on topics that can aid us in being a better advocate for our patients and the community that we serve. Some of these topics centered on storytelling, digital advocacy and power mapping. We learned about the Center for Artistic Activism, the importance of community engagement, and how to write op-ed pieces and letters to the editors, and many more. These sessions can be summed up in one quote: when we come together as a community to collaborate, connect, and listen to each other, our possibilities are endless. I was also a part of the DFA FDA task force. This task force consisted of medical students, residents, and attendants. I learned so much about FDA regulatory process and the drug approval reforms that need to occur, such as reforming the accelerated approval pathway for drugs. We had opportunity to submit in public testimonials and flying to DC to advocate on Capitol Hill. Outside of my advocacy, I led and was awarded grant money from the American Academy of Dermatology, AAD, to facilitate their Good Skin Knowledge project, where my sister, my two colleagues, and I taught young girls the facts about common skin, hair, and nail conditions. We had a great time as we made skin models and UV bracelets. As a scar and alopecia patient and one of the co-founders of the medical student program of the Scar and Alopecia Foundation, SAF, I wrote, created, and submitted a proclamation request to my state governor, Illinois Governor J.B. Pritzker, to acknowledge September 2022 as a National Scar and Alopecia Awareness Month, NSAM. This was the first proclamation ever submitted and the first to be approved for scar and alopecia. I took part in the AAD's 2022 Legislative Conference as a patient advocate for the Scar and Alopecia Foundation and visited my representatives and senator's office to discuss reforming step therapy protocols, reducing prior authorization burdens, and ensuring Medicare stability for patients and physicians. I continued my advocacy efforts in DC and was a patient advocate for the Scar and Alopecia Foundation for the Coalition of Skin Diseases 2022 Capitol Hill Day. CSD consists of more than 15 dermatologic patient organizations, and together we visited the members' offices who served on certain committees, such as House Education and Labor Committee, House or Senate Appropriations Committee, and Senate Commerce, Science, and Transportation Committee. I got involved in the Polycystic Ovarian Syndrome 2023 Advocacy Day with PCOS Challenge. We met online with our state and federal reps, and our ask centered on co-sponsoring the 2023 PCOS Awareness Month resolution and prioritizing the 2024 PCOS report language to the NIH, HHS, and FDA. I had the chance to join the Illinois Dermatology Training Advocacy Day Committee, and we had a forum where we invited speakers to discuss relevant themes and rising concerns regarding advocacy engagement and health policy work for medical students and dermatology residents. I'm a member of two CMS technical expert panels as a patient advocate, a family caregiver, and consumer. I work with various stakeholders offering my unique perspective and experience with the healthcare system to help create relevant, useful, and easily understood measures to people experiencing care and services in the healthcare system. I provide feedback and recommendations on policies impacting national public reporting and value-based payment programs, and guide the development of key national documents guiding the future of quality measurements and quality activities across CMS. My biggest project to date and the first initiative of its kind is obtaining and advocating for ICD-10 CM codes for both central centrifugal cicatricial alopecia, CCCA, and frontal fibrosing alopecia, FFA, through the CDC. We received positive feedback from the public, and I was able to garner 15 letters of support from dermatology organizations and dermatology patient-focused organizations, in addition to letters of support from 20-plus dermatologists and many scar and alopecia patients. This is a big feat for the scar and alopecia community. Creating specific codes for CCCA and FFA will provide more accurate diagnoses, allow for more accurate estimates of their incidence, prevalence, causes, symptoms, and health visits. Many patients and the public do not know the difference between non-scar alopecia and scar alopecia. Currently, there are no approved FDA drugs for scar alopecia patients, which often leave patients feeling defeated and hopeless. I also collaborated and partnered with Illinois State Representative Debbie Myers-Martin to create a resolution for the 2023 National Scar and Alopecia Awareness Month NSAM. Resolution Bill HR 0329. Thank you, Representative Myers-Martin. For 2023, I submitted another proclamation to Illinois Governor J.P. Pritzker to recognize September 2023 as National Scar and Alopecia Awareness Month NSAM. For the second time in a row, this proclamation was approved. Thank you again to Governor J.P. Pritzker. I would like to thank my mom, late father, and sister for their love and support and always encouraging me to pursue my dreams. I would also like to thank the Doctors for America, DFA's mentors and staff, FDA Task Force for giving me the opportunity to be a Copello Fellow, and for the speakers who poured into us over the course of the year, and to my co-fellows who I learned a lot from. Again, thank you.